Hi, Jason Tushman back here with Spot On Patient Acquisition, episode number 12. We've had some additional inquiries come in over the last 30 days in regards to focus some time specifically on lead to schedule rate for email leads. So that's what we're going to do in today's episode. So our best practices for email lead follow-up, okay? Our benchmark, our key performance indicator is going to be between 35 and 45% lead to schedule rate. For every 100 email leads that you get, 35% or 35 to 45 of those 100 should be scheduled to an appointment, okay? Now, what's the process, okay, to be successful in this? First and foremost, I'm going to tell you, leverage technology, okay? Leverage marketing automation. If you have leads that are in your system and they don't schedule to an appointment, you should be able to automatically send emails to those consumers in a fashion that reduces workload on your staff. So definitely leverage marketing automation. There's a ton of tools out there for a couple $100 a month to take advantage of technology to the benefit of your staff and the increase in opportunity for the practice. But at a high level, the process should be as follows. Your first response to an email lead should be immediate. It shouldn't be hours, it shouldn't be minutes. It doesn't matter as much who the response comes from. What matters is how fast it occurs. Make it immediate, make it by phone and make it by email. Set up the systems in place to do that. Your second attempt to follow up with an email lead, if you aren't able to get a hold of them on the first attempt, should be within 3 business hours. Okay, it should be within 3 business hours of that first attempt. That should all occur on the first day. Now, if you aren't able to schedule them during this time, which by the way, your first 2 attempts are going to lead to 80% of what you schedule, okay, is going to occur in your first 2 attempts. If you aren't able to get a hold of them then what you do, you go to what we call the next day AM, next day PM. You should make 2 more attempts the next day. 1 in the AM, okay, and 1 in the PM. All right, again, by phone, by email, okay, both times. Email should be done through automation. Phone should be an actual consumer or an actual employee reaching out to discuss the opportunity to schedule that person for an appointment based on their interest. Now, from there, it's going to be pretty difficult to get them to schedule at that point if you aren't able to get a hold of them. But give one more attempt, at least through email, either in day 3, it could even be day 5. But use marketing automation to grab that last attempt. And worst case scenario is you have somebody in your lead funnel now, and you can market future events and opportunities to get to know you better through that. Hope this helps you. Remember, 35 to 45% lead to schedule rate. Use marketing automation, okay, for your email follow-up. Be consistent, and I got to tell you, most importantly, be immediate, okay? It's less about who the response comes from. It's more about how fast it comes. Hope this helps you. Look forward to seeing you next time. Bye.